this is something which we see along with hypospadias. What is this? This is the curvature of the penis totally. So whenever there is a curvature, we call it as chordae. And depending on the angle of the curvature, it is classified as mild, moderate and severe. So this curvature, this ventral curvature of the penis, that is chordae, can occur with hypospadias or it can occur even without hypospadias also. Just that curvature will be there. Okay, so you have to identify chordae one. One more thing is you have to look at how is the foreskin? You have identified the urethral opening here at the ventral surface. Okay, look at the foreskin. Sometimes it is very hooded and all. So if it is hooded, you will not be able to look at the tip or identify where the tip of the penis is. So something like that, you will have to hooded foreskin also. You please take care where the tip is, you have to identify it. Clinical feature is what I told you. Parents come to us and say there is abnormal spraying, doctor. It doesn't come in a single streamline. So that is one important clinical feature. It can be associated with other ambiguous genitalia also. So ambiguous genitalia in, say in case you get a baby where you are not sure. So this is an ambiguous genitalia. You palpate and see for the gonads. Okay, it doesn't look like a scrotal bag. You cannot palpate a gonad. So in such cases, what you will do, you will immediately go for the next set of investigations. You do a karyotype, you do the hormonal assay, etc. You will involve a urologist, you will involve a geneticist. Okay. So ambiguous genitalia also you have to keep in mind when you have a child with hypospadias. So depending on where the urethral tip is, you will classify hypospadias as proximal, distal, or you can classify as anterior, middle and posterior. So this is anterior, middle and posterior. Anterior one, that is near the tip. Normally this is the tip of the penis where the urethra opening. Just near the tip, it can be either in the glandular or in the coronal or the subcoronal area. This is going to be the most common type of hypospadias. Okay, 65 to 70% of the hypospadias is actually your anterior hypospadias, or is otherwise called as the distal one. The middle hypospadias is basically which is present in the shaft. It can be present in the distal shaft, mid shaft or in the proximal shaft. Okay. Third degree, which is actually present in the penoscrotal or in the scrotal area or even in the perineal area. This is the posterior type of hypospadias, which is going to be your severe variety of hypospadias and the rarest variety of hypospadias. Mostly this perineal or the penoscrotal or the scrotal hypospadias is associated with ambiguous genitalia. Okay. So distal is going to be the most common 65%, penile 25% and proximal hypospadias is around 10%. So chordae we have just explained, it is going to be the ventral penile curvature. Even though it is not associated with hypospadias also, refer to a pediatric urologist. Mostly there is it is repaired through surgery at around 6 months of age. Okay.